Hello, my name is Haley Jaggerwall, and I'm going to perform my physical assessment today.
Hi, I'm Amelia Rowland. I'm a nurse midwife, and I will be proctoring the exam.
I'm the patient. This is a volunteer patient.
Okay, so we're going to start by assessing your skin, okay? We're going to start with the upper extremities, if you'll sit on the side of the bed there. Looking for color, temperature, turgor, and any lesions. We'll look at the nail. Capillary refills less than 3 seconds. Adhere to the nail bed. No signs of clubbing. Contour is about 160 degrees. Okay, looking at the nail, less than 3 seconds. Capillary refill. All right. We'll look at the lower extremities. Checking for, again, the color, texture, and a turgor of the skin. Looking for edema, any lesions or varicosities on the leg. Okay. And looking at the nails of the feet for contour, condition, color, shape, and capillary refill. Okay. Then we will move to the head, assess for size, shape, and symmetry. The head is normal proportion to the rest of the body, symmetrical along the midline, and of appropriate shape. We're going to palpate the skull and the scalp and the hair for any tenderness, tender spots. Okay, lesions, looking at hair distribution. Hair is thick, of a wavy texture, not greasy, and evenly distributed. Okay, we will palpate the face, the paranasal sinuses. Okay, the TMJ open and close, and there's a slight click. All right, then we're going to assess the masseter muscle, grit, and grit, excellent. And we will assess the jaw strength, open, okay. And then if you can move your jaw side to side, okay, excellent. Next we'll assess the sensory of the face, okay. I'm going to take a cotton wisp and just touch slightly the side of your eye. All right, very good. And slightly. Okay, very good. Next, we'll do soft and sharp, okay? So I want you to, this one is the sharp. Okay. This one is the soft, okay? And you tell me what you feel.
Soft. Sharp.
Okay.
Sharp.
Yes.
Soft. Sharp.
All right.
Soft.
Very good. And then, does it feel the same on both sides? Okay, great. So next, that's all the trigeminal nerve. We will do cranial nerve 7, okay? So we're going to assess for symmetry with a smile, very nice, and a frown, okay? Raising the eyebrows, looking at the ridges are symmetrical all the way across, good. And squinting, the eyes closed, don't let me open. Excellent. All right, we're going to puff out the cheeks. Very good. And Persian droop. Okay, very good. So that is cranial nerve 7. Okay. That's the face. And we did the paranasal sinuses. And now we're going to go to the eyes. Okay. And we're going to assess, palpate the eyebrows. No edema, swelling, hair is equally distributed bilaterally. We're looking at the eyelashes. There is no exudate or drainage around the eyes. The eyelashes are equally distributed and thick, and they are of appropriate length. There is no swelling around the eyes. We're going to look at the conjunctiva, okay, which is pink, and intact. The sclera is white, and the anterior in front of the iris and area is clear, okay? And the pupil is rounded, okay? So then we will take our pen light and we're going to assess the pupil light reflection, okay? And also the it constricting consensually and directly, okay? So first I'm going to shine the light on your nose. Very good. And the light reflects in the same spot in both pupils, okay? Next I'm going to check for the constriction. Very good. And next eye. Very good. And they reflect, or I'm sorry, constrict equally, okay, to the light. We're going to assess for lid lag. I'm going to have you look at the ceiling and look straight down, and then again at the ceiling and straight down, okay? And that is the palpable fissures in the opening of the eyes. Okay, sorry. No, okay, doing good, good. So that is that part of the eye assessment. The next part of the eye assessment is the we're going to test some more of the nerves. Okay, so I'm going to pull my chair up next to the bed. We will sit equidistant from each other. We're going to check your peripheral vision, okay? Covering the same eye, and then you tell me when you can see your hand, my hand. Okay. All right, excellent. Let's cover this side. Yep. Okay. Oh, okay. And then we're going to do 4 quadrants, okay? Covering the same eye, and you tell me how many fingers? 2. Uh-huh. 1. Uh-huh. 2. 2. Yes. I wiggled them there. Okay. And the next eye? 2. Uh-huh. 1. Yes. 2. Okay. 1. Perfect. All right. While we're here, I'm going to have you look at my finger, and then look at the wall behind me, and then look at my finger, and then look at the wall behind. Okay, great. And that is accommodation. Okay. So. Then we're going to do the cover and uncover test, and we're just checking for fixation of the eye. I can see that your eyes don't move to the side, so, but we're just going to cover and then switch and then switch. All right, and there's no noted fixation, okay? Very good. So with that, we will then do the 6 cardinal positions. I want you to just follow my finger. Okay, we're watching the eye movement. We're checking for nystagmus. All right, very good. Okay, so that's the 6 cardinal positions. We already did the light. And I believe we can go to the ophthalmic exam now, okay? Whew. So, make sure the ophthalmoscope is on, okay? And we will start with this eye, and we look for the red reflex, and then move in and find the optic disc. Go around looking at the vessels. All right, I see 4 vessels and 4 veins. The cup is 1/3 the size of the optic disc. There is a clear viscous membrane, and no exudate is noted, and I can see the fovea and the macula there. All right. Okay, very good. And we will repeat on the second eye. Again, looking at the red light reflex, and moving in to the optic disc, following around the vessel, and again, the other vessel. Okay, optic, the cup is again 1/3 the optic disc, and the fovea and the macula look clear. Okay, very good. assess the eyes, we can now move to the ears. For the ears, we will look at the auricle and mastoid area. No lesions, no tenderness, okay, no erythema or swelling. We'll take our otoscope and with an adult ear, pull up and back. And we will look inside the ear. I see the pars tensa, umbo, the malleus, the tympanic membrane is clear of a kind of opalescent grayish color, and the light reflex is present. Okay? Again, looking at the auricle and mastoid area. Okay? No swelling. We will pull the ear up and back. Very good. Light reflex is present. Pars tensa, pars flaccida, the malleus and the umbo. Tympanic membrane is intact. No swelling or edema noted. Clear, kind of opalescent coloring. Looks very healthy. Okay? For the ears, we will perform a whisper test. Okay? I'm going to stand slightly behind you and just whisper.
6, 2, 4, 2.
All right.
1, 2, 3, 4.
Excellent. Okay? We will also perform a Weber test. For this, we'll use the tuning fork, and we will activate the tuning fork. I'm going to set it on the top of your head, and you tell me if you feel the vibrations and hear it in both ears equally. Okay? Yes, I do. Okay, excellent. Then we will do the Rhine test, which we will use the 512 millihertz tuning fork. Again, I will activate it, place it slightly behind the ear. You tell me when you stop feeling it in the bone, okay? And then we'll test the air conduction as well. Okay. Not here. Okay, excellent. And that is the Rhine test. So we have done ears and eyes. We will move to the nose. Okay. The nose will look for size, shape, and symmetry. It is in the face in the midline, equal on both sides. Both nostrils appear to be open. We're going to test the patency. Okay. If you can close one nostril and breathe in, and out, and repeat. In, out. Excellent. We're going to check the olfactory, okay? Again, blocking one nostril. And what do you smell?
Chocolate and coffee.
Yum. Yay. And we'll check the other one.
Oh, alcohol.
Yes. Okay.
Chocolate and coffee again.
Chocolate and coffee. There we go. Okay. So that is the olfactory. We will look inside the nose using our otoscope. Okay, and we are assessing the turbinates are pink, intact. The septum is intact. It is midline. Okay, mucous membranes are moist. No clogging or blockages noted. And that's the nose. Next, we will move to the mouth. Okay, so with the mouth, we're going to assess the lips. They are pink, symmetrical, no lesions or lacerations or swelling noted, okay? We're gonna look at the upper gums and inner bucca, okay? And again, at the labial frenulum, and all the teeth are intact. Very good. We're gonna have you go open, and we're gonna lift the tongue to the roof of the mouth. And she's got a bit of a tight frenulum, all right? But with some assistance, we can see the Wharton's glands. To the side, we see the Stenton's glands up behind the second molars. Mucus is pink and moist, okay? We're gonna go ah, and once more. All right, and we see a bilateral equal rising of the soft palate and the uvula, and there's no redness or swelling or exudate in the back of the throat, okay? For the tongue, if you can stick it out, and side, we're checking the hypoglossal nerve, okay? And one more, just looking at the tongue good, nice and pink, equal distribution of the papillae, no color irregularities, and no swelling or tenderness of the tongue, okay? Very good. And that's the mouth. Next, we will move to the neck, okay? Starting for the neck, we will assess the cervical spinous process. Okay. We will look for symmetry of the neck and alignment. We will palpate for the trachea, that it is midline and symmetrical, and it is here. Can I let you swallow? All right, great. And swallowing also stimulates the vagus nerve or something. We did not do a gag reflex, but it can be done during the mouth assessment as well. Okay. So with the swallowing, we watch the thyroid rise and fall, and we will palpate the thyroid. And I notice that yours is slightly enlarged. Do you have thyroid problems?
I have hypothyroidism.
Very wow. Look at that. So she has enlarged thyroid due to hypothyroidism. With that, we will palpate carotid arteries. And then we will also auscultate for the thyroid, since she is known to have hypothyroidism, and auscultate our carotid arteries for bruits. We'll also palpate for the lymph nodes, starting with the pre-auricular, moving to the post-auricular, okay, the submandibular, sublingual, occipital, deep, and the supraclavicular. Okay? And we will also test range of motion for the neck. We can turn the head side and side, and then ear to shoulder, and then forward and back. Okay? And then we're going to do the same movements against resistance. Okay? Ear to shoulder, or yeah, this way. Ear to shoulder. Perfect. And rotate. Okay. Rotate. And forward and backward. Great. Okay. And I think that's the neck. And we're going to do a shoulder shrug against resistance. And very good. Okay. So that's the neck. Next we will go to the lungs. For the lungs, we will start with palpation of the anterior and posterior fields for any crepitus, any tenderness, any masses or bulges. Okay, no tenderness. All right, and we will auscultate the anterior fields. And the posterior fields. Excellent. We'll also want to check for firmitus, okay? So to do firmitus, I'm going to put my hand on your chest and ask you to say 99, okay? And I'm going to feel for the vibrations.
99. 99.
Yes.
99. Yes. 99.
Great. And we're going to repeat it on the back.
99. 99.
Great.
99. 99.
Beautiful. We'll also want to percuss the lung fields, okay? And listen for nice resonance. When percussing, I'm just going to go around on the back. We're also going to percuss to find the diaphragmatic excursion. So with the lungs empty, I percuss down to the line of the diaphragm and note where we're at, okay? And then take a good deep breath and hold it. And again, we percuss to the line of the diaphragm. And we would measure in centimeters. Yeah, you can breathe out, that's fine. And we were about 4 centimeters. Excellent. Oh. Okay, so that's the lungs. And now we will move to the heart. Again, we will lay you back. Excellent. Okay. Looking at the chest for any thrills, discolorations. Okay. We will auscultate aortic, pulmonic, Erb's point. Switching to the bell, we will do the tympanic. And then again, with the bell, mitral. Excellent. Now while we're at the mitral, we will palpate for the point of maximal impulse, right, which is in the intercostal space. Okay. So while we're doing the cardiac, we will check brachial pulse, radial pulse, bilaterally. Make sure they are equal bilaterally, and temporal pulses. Okay. I'm just going to go ahead and do these over here. We will check the popliteal, dorsalis pedis, and posterior tibial. Dorsalis pedis and posterior. All right, excellent. And that is our cardiac and vascular system. Next, we can move to the abdomen. first we will inspect the abdomen for any skin discolorations, like any peristalsis, any striations, and you don't have any. You have a nice, even abdomen. And abdomen, we do auscultation first. So we will begin by auscultating each quadrant for bath sounds. Excellent. While here, we will use the bell. Listen for aortic, iliac artery, iliac artery, and femoral, and again femoral. All right, no bruise heard. Okay, so that's normal. Then we will perform our palpation. Let me know if there's any. Okay. Palpate up to the site of the liver. Feel the liver's lower edge and take a good deep breath. All right, and relax. And measure the size of the liver. In a minute when we do the palpation. And we'll palpate for the spleen. We will palpate for the kidney. Okay, and then the other side. Just gas. Just gassy, sorry. And then we will do our percussion, and we percuss up. Did you get that gas? Did you hear the gas? And measure the size of the liver, because the percussion sound will change. The sound changes around 7 centimeters. Okay. Percuss over the spleen. And rest the abdomen. All right. And nice tympanic sounds. Okay. So that is the abdominal assessment. All right. We'll go ahead and have you sit back up. Move to the musculoskeletal assessment, okay? Again, we will start from top and go down. So we'll start at the neck, okay? Range of motion, moving side to side. And down, and back. And then the same movements against resistance. Head down, okay? Yep. You're good. And forward and backward. Excellent. Okay. Then we will go to the shoulders. We will palpate the shoulders and the scapula. Any tenderness, swelling. Just very regularly. And then we'll raise forward. And if you can get your arms behind you, excellent. Very flexible, okay. And then side, and up, and down. And other side, and up, and down. So we're going to repeat some of these movements against resistance. Arms to the side, and try to push up, okay. And try to push down, very good. And then, like you're pulling biceps against, okay. And pushing down, excellent. And that's testing the triceps as well. Okay, so then we'll do the elbows, elbows will finish the shoulders. We're going to our Wonder Woman poses, and in and out, and we're going to adduct our arm across the body. Excellent. Okay. And we're dancing. Next we go to the elbows, which will straighten and flex. And then for rotation, rotate the hands out and medial. Excellent. And the strength test for the elbows is the same as the shoulders, so we'll just move on to the wrist. Okay, we have palpated the elbows, we are palpating the wrist and the hands and each of the finger joints. Alright, no swelling, redness, or tenderness. For the wrist, down and up, and kind of like, yeah, in a circle, very good. And then fingers out and together, fist, and then thumb to each finger, and then thumb to the bottom of the pinky. All right, very good. So for testing strength of the wrist, I'm going to have you put your hands flat, push up, push down. Okay, excellent. Try to push your fingers out with me holding. Excellent. And with your fingers out, try to keep pull them in. There you go. And pull them in. Great. And then for fist, try to squeeze my hand. Excellent. Okay. And that's the wrist and fingers. Okay. And the strength. Next, we'll go to the hips. Okay. So, yeah, no, stay standing. You're fine. You're fine standing. I'm going to palpate around all of the hip joint and along the back, iliosacrospinal alignment, and these tendons here in the front, which are a little bit tense. But I know earlier you told me you did a lot of gymnastics as a child. We've got some tenseness with our hips. Okay, so we're gonna do our leg forward. Do our leg backward. Okay, excellent. And again, leg forward and leg backward. Okay, good. While we're standing, let's go ahead and do our gait. Okay, take 3 steps forward. All right, excellent. And 3 steps back.
Like backwards or like?
I meant walking normal, but coming back to me.
Sorry.
Yeah, nope, perfect. Excellent. Okay, very good. All right. So, next we will test the rotation for the hip, and I'll just go ahead and have you open it. We will do hip and knee, ankle, and foot on one side, and then we'll do the other side, okay? So starting for the hip rotation, we'll lift the leg at the knee, doing knee to chest, rotating leg in, rotating leg out, okay? Then we're going to put our knee, our heel on our knee, rotate leg in, rotate leg out, very good. Okay, we're going to straighten the leg, try to push up, oh, very good, and push down, excellent. All right, moving to the knee, we'll just relax our heel here, we'll palpate the knee, and in doing the slight, we notice that the knee is off a little bit. We will compare with the other knee. And this knee is moving slightly different than this knee. You said you have had a tendon in it before?
Yeah, I lost my posterior cruciate ligament.
Okay.
15.
Great.
I never repaired it.
You never repaired it. So we can see a difference in the movement and the shape of the left knee to the right knee. So when we practice our knee movement, we'll straighten, extend, and flex.
Okay, open.
Very good. And do you have any rotation in this leg? Okay. All right, a little bit. Okay, good. So testing the knee strength, if you can press down from the knee and press up.
I have no strength in that direction.
No strength in the upward direction. All right. Very good.
I have to use this muscle for that.
Yeah. Yeah. So We'll just note that in our chart. We're going to check the popliteal pulse while we're here. Okay. We're also going to do, I think we did the earlier. The posterior tibial dorsalis pedis. But because I'm at the feet, why not? We're assessing the ankle, palpating. Palpate the top of the foot and all of the toe and foot joints. Top of the foot is malleable. Can you flex your foot and point? Excellent. And can you rotate your toes sideways? Excellent. And then we'll just do against resistance, pushing down and pushing up. Very good. And wiggling of the toes. Great. So again, starting at the hip, bending knee to hip, rotating out and in, and then we'll put the heel to the knee, and again rotating out and in, and out and in, and we will just slide down, okay? We will test leg strength. Can you lift against resistance? Okay, and can you push down? Excellent. And we'll move to the knee. Palpate. Versa. Yeah. Okay. And then bending and straightening the knee. Flexion and extension. Excellent. And then pushing down from the knee and pushing up from the knee. Yeah, a lot more strength in this leg. Like it really is. All right, and then do you have any rotation in this leg? All right, and some slight more rotation as well. Okay, good. And we can relax the leg down. And we are palpating the joints of the ankle, and along the feet and the toes. And we will test ankle movement up and down. Can you rotate? In and out. Very good. All right, and again, against resistance, up and down, and wiggling the toes. All right, excellent. So that is the musculoskeletal, okay? And then we can go to let's discuss some things, okay? So let's discuss the Snellen, which is an eye acuity exam that can be performed testing your vision. It's typically used with a chart, and you would stand 20 feet away. Charts typically have letters, but for those who are not able to read or for small children, there are charts available that have pictures on them. You would read down as far as you can. The lowest line with 2 or less mistakes would be your visual acuity. It's tested one eye at a time and then both eyes together, okay? Another visual acuity exam that could be for test strategy is a card. You hold 14 inches away from your face, read down to the smallest line possible with one eye, the other, and then both eyes, okay? That one's typically done for driving exams, okay? So we have done our gait, but let's go ahead and stand up. And we're going to do the Romberg test, okay? And for the Romberg, we'll just stand with a normal stance, eyes open, okay? And we're focused and we're doing very good. And then we'll close our eyes and notice for any swaying. All right, and no swaying, we've got a good balance, okay? Very good. So then we will do a fast motion test, okay? I want you to flip your hands as quickly as you can. All right, excellent, very good. And then touching fingers as quickly as you can. Okay, very good. And then tapping of the foot and as quickly as you can. Very nice, and repeating. All right, excellent. We will also do a quick motion, and then there's So I'm going to have you put your hand out, all right, and I'm going to place an item in your hand, and you tell me what this item is.
That is a key.
All right, excellent. And for the other hand, other hand, you tell me what number I am writing.
5.
Yes, excellent. Okay. Movements. Oh, the position test. We're going to do a position test now, okay? So what I will do is I will raise your thumb. This is the up position. This is the down position. And you tell me what your thumb is in, okay?
Should I keep my eyes closed?
Closed, yes. Eyes are closed. Okay. Thumb is?
Up.
Okay.
Up.
Yeah.
Down.
Okay.
Up.
Very good. And we'll repeat on this hand. Again, this is the up position. This is the down position. Okay?
Up. Down. Down. Up.
All right. Very good. Okay. We'll also do that with a sensation. So I'm going to turn on the tuning fork again. And you tell me if you feel vibration. Okay?
Yep. Yep. Yes.
Okay.
Yes. Yes. Yes.
All right, very good. And we'll do wood for the lower extremities as well. All right, so the position test, this is an up position, this is a down position,
Okay.
eyes closed.
Okay. Up. Down. Down. Up.
Very good. All right, this is the up, this is the down, eyes closed.
Down. Up. Up. Down.
All right, very good. And we will repeat with the vibration, okay? And you just tell me if you feel vibration.
Yeah.
Okay. Very good.
Yes.
Okay. And that is our vibration test. So for our last test, we will do some deep tendon reflexes. Okay. We're going to start on the brachial, okay, which is up here in the upper arm. Oops.
Sorry, this down.
Oh, I know. Don't spend enough time with these hands, right? All right, and we're just relaxing our arm. All right, very good. Next, we will move to the tricuspid. Nope, not tricuspid. This one. Ooh, yeah, okay.
Good triceps response there.
Yeah, very nice triceps. And then we will do the radial. Okay, very nice. That was very good. All right. And again, we'll find the brachial. Okay, we saw the muscle move. So we'll do tricep. Yeah, very good. That's so cool. And the radial. Okay. We will go for the patellar. We're relaxing the leg. All right, there was a slight response there. All right, very good. And the next one. And the Achilles. So holding the heel, no, holding the leg, we will tap the Achilles. And look for foot jerk. All right, and that is a physical assessment.
Ooh, I get chocolate. Chocolate!